Good afternoon, everybody. I'm José Reyes from the PROS Research Center at Universitat Politècnica de Valencia, and I'm going to talk about our work, a model-based application for the effective and efficient management of data associated with retina-macula pathology. This work has been developed in conjunction with Alejandro Marco, Alberto García, and Óscar Pastor. This will be the outline of this presentation. Firstly, I will talk about the introduction and background of this work. Later, we will define our conceptual model of the macular pathology. We will continue with the solution design and validation, and finally, the conclusions and future work. Information systems play a key role in health as they facilitate professionals to provide efficient and effective services to users. Besides, information systems improve both the quality of healthcare and decision-making of clinicians, which has a direct impact on treatment costs by generating significant savings. That is why experts in health science and software engineering join forces with the aim of facilitating innovative solutions to the challenges that arise in this domain of great importance for society. The age-related macular degeneration, AMD, is an example of such a significant challenge due to the high probability that people over 50 years of age have of suffering from this anomaly. The macula, which is a pigmented area that is located inside the retina, plays an essential role in the process of vision because it allows us to have a detailed view of the things around us. Furthermore, this domain presents a series of problems from which we can highlight the following. The first one, the complexity of the domain, based on the context of clinical data, a changing environment, among others. The second one, the difficulty in the management of the data, which prevents from obtaining correct data integration and harmonization. And finally, the third one, the high costs that are generated in their daily work due to the lack of information system that allows them to correctly manage the data associated with the treatment and evolution of patients suffering from this pathology. The goal of this work is to present our work in a real-world use case in collaboration with the ophthalmology service of the Conselleria de Sanidad, in order to provide an information system that improves the management of clinical data. This solution helps in the understanding of an increasingly prevalent pathology that has an increasing pharmaceutical cost and that requires more and more healthcare resources. We developed an information system for the analysis and management of the data of patients treated for macular pathology. To achieve this goal, the following specific objectives have been determined. The first one, to study and analyze the macular domain together with clinical experts in order to define a conceptual model of the macular pathology. So, this conceptual model is intended to provide a common ontological framework to discuss with experts in order to increase our understanding of the domain. It will also guide the development of the information system to improve data management. The second one is to design and develop an information system that is based on the defined conceptual model. This information system will improve the integration and management of existing data in the macular domain. It will also help clinical experts to improve their decision-making activities. The advantage of using conceptual modeling techniques have been demonstrated several times in clinical practice. Consequently, software developers use conceptual modeling techniques to add value when defining their processes. Currently, there are a lot of words whose aim to provide with sound solutions to the existing problems regarding health. Here, we present some research works related to the application of conceptual modeling techniques in different health contexts, for example, in clinical and genomic data. As we can see in this first one, in the Patton works, he brings the definition of conceptual models on the genome approach from different perspectives. In Ram's words, we can show, they shows the application of conceptual modeling principles in the field of proteins. In Burriel's words, we can find a proposal of an information system for the management of clinical and genomic data, applying conceptual modeling for breast cancer. Other words was relating to applying conceptual modeling techniques to define a holistic perspective of the human genome domain. Others were applied in the management of genomic data for citrus, for neuroblastoma, and also the application of conceptual modeling principles to help the management of genomic data. Currently, there is only one program worldwide called Fight Retinal Blindness, whose license per hospital costs around 30,000 euros. This product has limited access and is not easily accessible. In the case that the hospitals that we mentioned before, they didn't have access to this kind of solution. The use of conceptual model in the life science domains facilitates the understanding of all the participating concepts in this complex and continuously growing context. This work presents the design and development of an information system based on this conceptual model, which aims to be implemented in the ophthalmology services of different hospitals in the Valencian community. The result of this work is a conceptual model of the macular pathology, which is represented in this picture. This conceptual model in the version 1 is composed of 3 different views, grouping the entities which are related in some way. These views are structural, patience, and evolution. The structural view stores the information associated with the doctors and hospitals in the system. This part is more focused on the management and control of human resources and system infrastructure. The patient view contains all the information of the patients during the start of treatment and next activities that they develop together with the doctors. And finally, the evolution view, it allows monitoring of the patient's evolutions, thanks to the definition of all the information related to their reviews and tests. After having defined the conceptual model that gathers the knowledge of the retina-macula domain, we can talk about the design and implementation of the resulting information system. The design and development of the GMAC information system was carried out from three different perspectives, which are defined below. The first one, the structural design. This task includes the creation of the application data model extracted from the conceptual model of the macular pathology. The second one is the functional design. This task focuses on the construction of an API in order to provide a service that allows two software to be connected together, facilitating the exchange of messages and information in a specific format. The last one, interface design, this task was focused on the design of the application's user interface. This proposal allows to increase the quality and integrity of the solution architecture. This work is part of an ongoing research project right now in a TRL4, on which the integration of all the improvements detected by clinical experts is maintained. Now we can see some images from the prototype user interface. Bieringa defines in his words the validation phase as the evaluation of the use of an artifact in a context in order to predict the impact of the artifact in the real world used by stakeholders. We validate our proposal solution together with the experts in Retina-Macula from the Valencian System of Health. Our validation process includes three exercises. The first one was the prototype validation, conducting several meetings with software developers and domain experts from our research center. The second one was the expert opinion, reviewing the artifact under laboratory conditions together with domain experts to obtain their feedback. For instance, in expert opinion, we validate the functionality of the generated artifact. We use the user interview technique, which allows us to gather domain expert feed in an agile way. The expert opinion exercise was divided into two steps: user observation and user interrogation. And finally, the technical action research that is currently being carried out together with the team of experts participating in the project. As a conclusion, we can say the goal of this work has been to facilitate an information system that is based on conceptual models, which improve the analysis and management of the data of patients treated for retina-macula pathologies in the ophthalmology services of the Conselleria de Sanidad. Two more specific goals were established to achieve this. The study and analysis of the domain, which allow us to generate the conceptual model of the macular pathology. The development of the GMAC prototype, based on the defining conceptual model, which allow an efficient and effective management of the data of patients with macular diseases. In this sense, we can conclude that the use of conceptual modeling techniques has enabled in two ways. The first one, get a shared understanding of the domain. Moreover, the conceptual model acts like the single point of truth to integrate and harmonize all existing data, allowing to generate knowledge through the possible application of artificial intelligence technologies, machine learning, among others. And the second one, facilitate an information system by applying a model-driven development approach, In this way, an information system can automate tasks and allows monitoring of patients where information is generated to determine which drugs are effective and under what circumstances, preventing medication from being wasted and result in more efficient use of resources. Our future work will be oriented to the evolution of an extension of this conceptual model, the generation of the second version of the tool, our prototype GMAC, and finally, the transfer of the software product. In the future, each hospital is expected to have its own user license. This is the acknowledgement of this work, and I would like to say thank you everybody for your attention.